And if there ever be a question about who we are Smooth 98.1.
Oh, Providence Bank, huh? Ah,
Preventive Bank.
okay.
Future forward banking.
Here we go. Studio now. And Lagos, you're welcome inside Lagos Talks, our final hour here for a Wednesday on Smooth 98.1, the Smooth Breakfast. It's Aya and Mazzino, and of course, we are going to be having a special on today's show. Just a quick teaser here that we're going to be having Dr. Nesochi Okeke Ibokwe to dispel some of the myths that we've been hearing about the coronavirus, and of course, give us a bit of an education on it. In just about a bit, we'll be introducing our guests, and of course, we'll be joined by you, of course, on our social media and also our WhatsApp platform with all the concerns and questions that you might have. We'll be right back.
Hi there. Let me tell you something.
Yeah, I didn't
about
see that.
Providence
Something
I noticed
keeps.
that because it's very the way it's put on the system is very confusing.
I hate that my voice comes after my voice. Oh,
To our
ah!
which is
Okay, you come back in. I'm like, I can't.
operations tailored to suit you at every touch
I
point.
hate this ad. I
Providence
hate
Bank.
it.
We know you don't like the queues,
And I
that's
think it's
why
actually
you won't
really
be
nice.
in any. Instead, we created a lounge for your comfort in every of our business location. We even have dedicated lifestyle concierge to assist you on your journeys around.
Yeah, we didn't see the
That
ad.
is how we define future forward banking. Choose a
We didn't
bank
see the
that
ad.
knows how important you are. Choose Providence Bank.
Wow, unknown
To
incubation
open a premium
period.
account with exciting possibilities, please dial 01-236-7715 or 0700-7768-4387. Providence Bank. Future forward banking. Providence Bank. Future forward banking.
All right, Ayo, please. Lego.
All right, Lagos, welcome back. It is Lagos Talks 91 here on Smooth 98.1. I am Myra Essay here with Mazzino Appeal. And as we introduced earlier on, we will be looking at and talking in detail today about coronavirus and the myths and the myths and facts. Joining us for the conversation this morning, we're really delighted to have with us Dr. Nesochi Okeke Igokwe. Now, Dr. Nesochi Okeke Igokwe is a Nigerian American, New York-based, area-based physician, health expert. She also is a writer and a blogger as well, particularly focusing on health matters and breaking it down in the most simple ways for the man on the street to understand. She's also a member of the inaugural class of the Bill and Melinda Gates Scholarship. So it's great to have you on the show this morning, and welcome to Smooth FM.
Welcome.
Thank you. It's a pleasure to be here.
As we mentioned, we will be looking at coronavirus, and again, just a few facts around this. This condition emerged in December 2019 in a place called Wuhan in China. At the time, it seemed like it was just something a concern, but not a major concern. However, it's now been declared by the WHO as a global pandemic, and a number of countries are taking certain safety precautions to mitigate the effect of the virus. We'll be looking at symptoms, looking at how it manifests. We'll also be talking about certain things that people believe about it, which isn't quite fact, and then actually presenting the facts. And globally, 80,000 people have been diagnosed with coronavirus, and it keeps spreading almost on a daily. It's affected not just the health of populations around the world, but also businesses, and the world markets have been impacted hugely. But the first thing I'd like to ask you, Dr. Nesochi, is what is coronavirus?
So, just simply speaking, coronavirus is a family of viruses that occur in both humans and animals as well. So, this new coronavirus, the novel coronavirus that everyone has been talking about, is the seventh identified coronavirus that actually causes human illness. The other six coronaviruses, these viruses, four of them caused things like just the common cold.
Yes.
Okay, the other two that were in the family, they caused more severe illness that could potentially lead to death. If you are familiar with the SARS outbreak that occurred
Yes.
in 2002, and then subsequently the MERS outbreak 10 years later, those were members of the coronavirus family that caused severe illness and death. The other four, the first four, just common cold symptoms that usually go away with time. So now enters this novel coronavirus, December 2019. In Wuhan, China, in a marketplace, they started noticing that certain people were just starting to fall ill with respiratory symptoms, basically breathing symptoms, and found to have a suspicious pneumonia. So there was kind of bewilderment as to how and why this was actually happening. So what was the theory was at the time that there was somehow transmission of a virus from an animal to a human, and thereafter there was human to human transmission. And that's usually how sometimes these viruses work. What we know of coronaviruses in the past that have caused serious infections, usually it's a zoonotic infection, meaning that an animal source infects a human, and then thereafter it just continues to exactly and spread in the community. Have we been able to identify what that animal source is at this point? No one really knows what it is at this point, but what we do know is there's this outbreak and we need to pretty much contain it. And the reason it's actually called a coronavirus, because when you look at the virus under a microscope, corona actually is the Latin term for crown. When you look at the virus under a microscope, it looks like it has like a crown-like appearance around the viral particles. So that's what encompasses a coronavirus. So this one is called the novel coronavirus COVID-19, which stands for Coronavirus Disease 2019, because this is the newest one. We don't know much about it. It's the first one, the newest one that's been identified, and things are just evolving on a day-to-day basis to try to figure out what the actual impact is going to be around the world.
So, so has there been like, have they identified exactly how long it stays in the human system, or when it starts to cause manifest into symptoms? Have they discovered it all?
So that's something that we're still trying to learn, but what you're referring to is what they call the incubation period.
Exactly.
Exactly. So that's the period of time where some of those symptoms may actually manifest. And we should actually go through what some of these symptoms are eventually. But that incubation period, their thinking was between 2 days to 14 days. That's why you keep hearing about people that are detected or suspicious of quarantine for 14 days. But the thought now is perhaps it could even be longer than that 14-day period. But but we are not sure. But typically they're using that 14-day mark as the incubation period, whereby symptoms will actually start to manifest.
Now let's talk about those symptoms. What are the symptoms? Because we know that we will talk about the measures in place for Nigeria that the Nigerian government have put, particularly for those traveling from areas that have cases of coronavirus. But what are the known symptoms of coronavirus?
So known symptoms can be moderate to mild to severe, as the severe ones that we're seeing in people that are getting very sick and even potentially dying from it. But those symptoms, the mainstay symptoms, are cough, fever, and respiratory distress, meaning that you're just having a very difficult time breathing. So those are the main things that we're actually looking for in regards to symptoms. But guess what? Those symptoms are symptoms that you can see in other respiratory diseases. So that's why it's kind of hard for people to figure out, is it just the common flu that I have, or am I actually down with the coronavirus? Have I been infected with the coronavirus? But the key thing is looking at travel history and exposure history. So if you're manifesting those symptoms, let's say you're walking around now and you have a severe cough, you are having fevers, and you are having respiratory distress, shortness of breath, and you can't breathe, and you've been in that area of China where this disease emerged, that is a cause for concern, and you have to alert a medical authority at that point. If you haven't had the travel history, but you've been exposed to somebody that has been to China recently, that should be a cause for concern as well for you if you're having those symptoms and you've been around somebody that has been sick, or you yourself you have traveled to that area.
in the case of Ebola, we were advised to be careful what kind of surfaces that we touched and stuff like that because it was able to transmit. So, but in this case with the coronavirus, you've talked about travel history, geography, and all. But what about imports? I'm asking because I don't know. There is the human-to-human transmission. What about perhaps surfaces? And I'm talking about imports from, say, China, for instance. Is there any need for concern in that regard?
Okay, so that's also one of the myths that I wanted to talk about because some people are scared to even receive packages or letters from China. But to date, what we know is that those particles are not going to last on the packages long enough in transit for it to actually harm anybody.
Okay.
That's the data that we have to date. So you really shouldn't be petrified or have any apprehension about mail or packages that you're getting from there because by the time those packages come from here, from China to here, it's likely that those particles, the viral particles, are going to be killed and dead. But in regards to what you're referring to, just surfaces and having that exposure, we really need to discuss the mode of transmission.
Yes.
Exactly
Yes.
what everyone's been talking about, the human to human transmission. So the leading theory now is that the mode of transition when it's human to human is by means of respiratory droplets. So what does that mean? So when you cough or you sneeze, any of those particles, the sputum, anything that comes out from your mouth when you cough or sneeze, those are the particles that are going to actually have a lot of the virus in it if you are somebody that is actually infected with coronavirus. So let's paint the picture. For instance, if there's somebody that's infected with coronavirus and they're going around coughing and sneezing and not covering their cough, not covering their sneeze, guess what? If those particles land on, this surface or land on your face or any mucous membrane, you can easily get infected as well based on those infectious droplets. So that's why it's very important to do certain things to try to basically avoid any of those respiratory droplets.
Now, for the sake of everybody listening, when you
Yeah.
say mucous membrane, you are referring to what parts of the body exactly?
So parts of the body, thank you for that. Parts of the body include the mouth, the nose, the eyes. So it's very easy, and we touch our faces all the time. Think about how involuntary it is just for you to touch your face. So for instance, just now, and if you were touching the table and somebody had, coughed or sneezed and you touched it and you didn't wash your hands immediately and there were viral particles on there, it's easy for you to accidentally just touch your face and then guess what? Get infected with any of those particles. So that's what you really have to be aware of. Hand hygiene is essential and is key at this point.
Very quickly now, antibacterial. So with regards to sanitizers, there's some arguments that it's a virus and this is antibacterial. Do they have any effect? If you're not able to quickly get to a hand wash to wash your hands with soap and water, can you carry around hand sanitizers and use them as an emergency cleaning agent?
Emergently, yes, you can, but if it should be an alcohol-based sanitizer that at least has 60% alcohol in it, and you can use that in that instance just to kind of wash and sterilize the hands. But it is best to really use soap and water. The recommendation is you wash your hands for 20 seconds, and what we usually say, that's about the amount of time it takes to sing happy birthday twice. So it's just not a matter of sticking your hands in the faucet and just taking it out. We have to actually be very careful in the method and the means of which we are actually washing our hands properly and giving it actually enough time to remove those particles. And if you're somebody that has nails, be aware of that as well. You have to really,
that's actually really important.
yeah, because you may think that you're getting all the particles off, but underneath the nails, that's really an area.
Carriers.
Exactly.
Yeah.
If you have nails, that's a huge carrier for you to have debris and pathogens, just, particles in there that can get trapped there.
All right, thank you very much. In case you're just tuning in, we've been speaking with Dr. Nesochi Okeke Iwokwe, and the topic for today's Lagos Talks special, Lagos Talks 91 special, is coronavirus, and we are going to be breaking down myths when we come back from this break.
Future forward banking.
I want to ask when we get back.
Let me tell you
about
something
this.
about Providence Bank.
Well, one of the
When
manifestations or the symptoms is increased body temperature. Is it? Yes.
Fever, yes.
Good. So the means by which they use to try and detect it, maybe at the airports or stuff like that, is how effective is that? That's what I'm going to ask.
Oh, okay.
So yeah.
Okay.
This is a very good question from WhatsApp. The person is asking, he's in a relationship with a flight attendant.
Oh.
What should one be worried about or watch out for?
That is
Although the
a
flight,
very
That's a great
relevant-
question, actually.
Although the flight route doesn't include China, passengers are always moving around. That's a risk.
That's a
from
yeah.
Wow.
Yeah.
Can
Oh,
you
that's a
do
great
that one
question.
first,
Yeah.
please?
That's a great question, actually. Yeah.
My boys are afraid for his life.
It's about to break up.
I'm telling you that. Don't let let's not see. Let's just have phone conversations, WhatsApp video calls.
Speak to our lifestyle concierge on how to open a premium account with exciting possibilities. Please dial 01-236-7715 or 0700-7768-4387. Providence Bank. Future forward banking.
98.1.
The best of everything in the morning, and more.
Less conversation, a little more action.
Weekday mornings, 6 till 10.
We're back.
It's still Lagos Talks 981 here on Smooth 98.1 with Mazino Appeal and Ayo Mairo essay. This morning, the conversation and the focus is on coronavirus, and we have discussing this with us Dr. Nesochi Okeke Ibokwe. In case you're just tuning in, before the break, we talked about the history of coronavirus. We talked about where it first originated from, that's Wuhan in China. We also looked at some symptoms and modes of transmission of the virus. We have questions from WhatsApp, and we will be sharing with you the ways in which you can communicate with us. We're actually streaming live on YouTube, so you can watch this aspect of the show. YouTube is Smooth 981 FM Lagos, and also on Twitter at Smooth 981 FM. On WhatsApp, actually, we're on 0809-444-0981.
Yeah, and what you meant to say was Twitter. We're at Smooth91 FM. You want to use the hashtag LagosTalks91 for this special that we have today. We have a couple of messages come in, Aya.
Yeah, so Patrick is asking good morning, great topic. In a relationship with a flight attendant, what should one be worried about or watch out for? Although the flight route doesn't include China, passengers are always moving around. I think this is such a good
Very
question,
relevant.
yes. And this could apply to people who have or relatives or married to people in jobs like this. What do you do?
So first things first, in that situation, make sure and identify that your partner has not been in any of those regions. If you've confirmed that, that's great. However, in the airport setting, you never know who has traveled where and for how long. So the best thing to do is make sure that you kind of avoid these sick contacts. If your partner is coming down with symptoms of any viral infection, whether it be corona, whether it be flu, whether it be anything else, that's a bit of a cause for concern because you don't know if she actually may have inadvertently come in contact with somebody with the condition, with all the travels that she's been doing. So look for the major mainstay symptoms of the fever, cough, and respiratory distress that we've spoken about. So the best thing that we can do at this point is prevention, because there's no treatment to actually eliminate the virus at this point. So prevention is key. If anyone is actually sick, whether they're a flight attendant or whatever job that they do, you need to make sure that you protect yourself and stay away from those that are exhibiting symptoms.
While we're on the subject of airports,
Yes.
now when you come through at any point, any country, there are these thermometers that are used to check temperatures. One of the symptoms, like you mentioned from before, is increased body temperature.
Exactly.
Now, how effective are these thermometers in checking the spread of the disease?
So the thermometer is not actually going to let you know whether or not you have the disease. And we can talk about how they actually test for it later and confirm the diagnosis. But what they're actually doing at these ports of entry is what we're calling screening, okay? Because we know that fever is kind of part of the clinical picture with corona, when they do check at the ports of entry, what they're checking to see is if your fever is elevated. Fever is defined as a temperature of 38.1 degrees Celsius or 100.3 degrees Fahrenheit. So if they're checking that and they see that you have a fever and they see that you've come from one of those places where corona is prevalent, then that could be a cause for concern, meaning that they may determine that you might be suspected to have the virus if you have all of the clinical symptomology, including the cough and shortness of breath with that. But the temperature probes are just a screening measure to, identify people that could be actually at risk for that. And, sometimes when we are screening patients, when you ask patients, have you been having fever? Have you not? Sometimes people don't even know
Yeah.
that they've had fever. And sometimes, unfortunately, people try to
Cover it up.
cover it up.
Yeah.
So I think I just mentioned this one good thing that I know Nigeria's been doing, just even in coming here. I wasn't coming from China. I was coming from the States
Yeah,
for
it's
my
good thing you
trip.
put out
Yeah.
Yeah.
put that out there, isn't it?
just to let you know that. But I was coming from the States, and every passenger coming into Nigeria at this port of entry at Lagos, when I got there, we had to fill out a questionnaire from the Ministry of Health here in Nigeria, pretty much asking you for your details, where you're going to be staying, name, contact information, but more specifically, if you've had any of those symptoms of cough, fever, shortness of breath. Have you been around anybody with cough, fever, shortness of breath, irrespective of where you were coming from? So that's just one tool that, the government is actually using to try to just kind of screen out. But like I said, with that said, some people could fill that out even if they're not having fever, even if they are having fever or they are having cough. Sometimes self-reporting is not quite accurate. So when you are coming from those high-risk places, when they are probing and checking to see if you have a fever, that's just a way to ensure that what you are reporting is in fact accurate.
Interesting. Another interesting question here from Ifan. It says, good morning, good morning, Mazino. Good morning, good doctor. When will a carrier of the virus become infectious?
So you are truly infectious when you're actually exhibiting the most symptoms. Okay. So when you are having the high fever, when you are coughing nonstop and, expressing out all those, all the sputum with the cough, with the sneeze, that is when you are really the most infectious. But the thing that is a bit of a fear for some, for the community, the international community, is that sometimes you can actually be asymptomatic, meaning you're not exhibiting any symptoms at all, and you still can potentially be infected and not even know, because some people can kind of be like a silent carrier, not knowing that they have it, because like I said, the spectrum of disease manifestation can be from mild to moderate to severe. So there are some people that may not even be exhibiting symptoms, but they may actually have, been in contact with somebody and have just have minimal symptoms. Yeah.
That's really important, and again, it's just about us being generally, keeping our general hygiene without even seeing a manifestation of symptoms from anyone. Chinwe Ikofomikoyu asks a very important, interesting question. Funny, I found it. In buses, people sneeze frequently. Will one be affected by other people's poor hygienic lifestyle?
Absolutely.
Yeah, that goes without saying.
Absolutely. And that's a fear too, especially in public places where people are cramped together and packed together. That's where you have to actually be the most careful, because guess what? Not everybody is on top of their hygiene in public or even in private at that. But when you're around that many people, you need to really steer clear of anyone who's sneezing and coughing around you. And that's even before Corona even came about. This is just general, general lifestyle habits to have. Just generally speaking, anyone who is coughing and sneezing, please cover your cough. I'll just repeat that. Please cover your cough. Cough into a tissue and dispose of that tissue properly, and then wash your hands.
Thank you very much. I think we have a number of questions that have come in. Perhaps we should go to the questions, because people have started to ask the questions on the myths that we're going to present to you.
Okay.
And Nee is asking, good morning, please, I would like to know if the report of chloroquine as a possible vaccine, if it's true.
So there have been experimental treatments that have been used, but nothing to date has been able to treat and clear the virus from anyone. And the chloroquine was not being used as a vaccine. When we're talking about vaccinations, before we get a vaccination for this condition, that's going to take at least a minimum of a year to a year and a half. Vaccinations are not created overnight. It takes some time. It takes some testing. So in the interim, while we are waiting to, figure out the best treatment moving forward, the best thing that we can do really is to have strong preventive measures in place and be prepared and have a plan if it does come into Nigeria. So to date, there's no treatment, there's no vaccine available.
Thank you very much. And sorry, just talk about the strong preventive structure in place. When a country or a nation like the US haven't, with their strong systems in place, still had it coming, still have cases of coronavirus reported.
Yeah.
What hopes do we have in Nigeria as a nation? Because people, yes, it seems like a condition or a disease that's far away. It's happening to people in Europe and Asia. However, we have had 2 reports in Africa, Algeria, and first in Egypt and then Nigeria. So
Exactly.
what hopes do we have in Nigeria?
Okay, so that's the major fear of the global community in nations in which the healthcare systems are not so strong. It may have a devastating effect if corona does come into these regions. So Nigeria is one place that if it does come in here, we need to have a strong plan in place. And I know that the Nigerian CDC, they're trying to establish protocols and get themselves prepared and ready if it does come in. A few things that Nigeria that they're doing that are good measures. The screening at the ports of entry, that's good. They've also established 3 laboratories that are capable of testing for corona, which is also good as well. And what they're doing is also trying to train medical staff on what to do when they are, faced with patients that may have corona or may have actually been diagnosed with corona. So the main thing is collaboration with regulatory bodies that can actually help in educating the public and educating everyone else so that we are aware and we know what to do if faced with anyone who may potentially have the condition.
Thank you very much. We have a comment here and question, and this is from Doherty from Queen's Drive, saying, "Thank you, Doctor, for enlightening us on the difference in the positional methods of coronavirus and transmission dangers. From what you have said, the most famous way of getting contaminated is via the respiratory organs. Unlike Ebola and HIV/AIDS, these aren't predominantly sexually contagious ailments, so it's all a matter of decency and keeping shipshape. In the case of contamination, what is the most effective antidote as regards checkmating the disease, and is transfusing the blood system an optional solution?"
So blood transfusions are not something that's been a known treatment modality for this condition. At this point, like I said, there's still no treatment. The best thing that can be done, to just repeat that, is prevention. Prevention is key, and prevention will come by means of proper hand hygiene. Just being more vigilant and more aware of how you take care of yourself and how you ensure that you are not spreading germs throughout the community. We have to really be strongly vigilant about this, about your hand hygiene, washing your hands, about covering your cough, about staying away from people who are sick. And about if you yourself are sick, it's okay to stay home and stay away from the general public. If you know that you're coughing up a storm, that you have a fever, don't go to work, don't go to school, seek medical treatment. And just to let you know, before you do seek that medical treatment, please give the doctors or the hospital that you're going to a heads up. If you do have that travel history as well, just let them know, hey, these are the symptoms that I'm having. I don't know if I've been exposed or not. Maybe I've traveled to China or wherever else it's been occurring, or maybe you've been around somebody else that's sick, but just give them a general heads up so they know how to deal with the situation once you do come into the clinic or the hospital. People should not be caught by surprise by it.
Thank you very much. All right, we need to go on a break now, but we have been speaking with Dr. Okeke Bokwe, and the focus of conversation this morning on Lagos Talks 981 is coronavirus. We'll be back in a moment.
Future forward banking.
This chloroquine question has come up a number of times,
Yeah.
and
Hi there.
so
Let me
we
tell you
answered that.
something
But
Yeah.
about Providus Bank.
this,
You
so
see, when
I think
we
when we
set
come
out
back,
to
we'll
do
talk about
banking,
testing.
we didn't
We
Okay.
haven't
just want
talked
to
about
do the
sorry.
Sure.
usual.
It's like,
Why do you want to-
yeah.
So
Okay.
testing
Yeah.
and how people can get diagnosed is just because if you have the symptoms, some people are probably coughing now and thinking, "Oh my goodness!"
Yeah, it's not about raising hysteria just because you
Yeah.
have a cough. Like you have to really look at the full clinical picture. Have you been traveling in one of those regions where this has happened? Have you been around somebody that you know that has actually been diagnosed with it?
Yeah.
So
To assist you on your
those are the
journey
key
hereafter.
things.
That is how we define future forward banking.
All right, so we said answering the questions on myths. So this
Okay.
segment will do testing and
Okay.
diagnosis, and then we go to myths.
Sounds
We're
good.
breaking down myths and then
Please
facts.
dial
Got it.
01-236-7715 or 0700-7768-4387. Providus Bank. Future forward banking.
This is IBK Spaceship Boy, and music to me is a vehicle by which I communicate my message of light to the world. Music is love,
Someone wants to know if
it's peace, it's joy,
alcohol
it's
will help
happiness,
the
it's
situation in any
release,
way.
it's
No, that's actually one of the myths.
That's just
That's
an
what it
excuse
is.
to drink.
That's one of the myths that I have down here. People have been either
Oh,
spraying
boy.
alcohol
Really?
and
You see, but this is
chlorine all over their
important.
body
You know why?
and
You
trying
know,
to drink it as well. Yeah,
Remember when it
chlorine
was
and alcohol all
when it
over their
was
body
salts for
and
Ebola?
drinking
Yeah.
it, thinking that it's gonna
Because we
clear
said
the
that,
body. Yeah.
the hand sanitizer should have alcohol.
Alcohol, so they
just
just
might as
assume
well
that.
just
No,
might as
no,
well just
no.
pour it on your body.
No, drink it now.
They're
Let's-
drinking it. They're pouring it all over their body. Like no, that can't.
Studio, should that be the first one?
Yeah.
All right, let's go. Here we go. Welcome back inside our special here for a Wednesday on Smooth 98.1. Dr. Nesochi Okeke Bokwe with us, helping dispel some of the myths that are going around the coronavirus infections that are going about worldwide. Well, Lagos, if you're just joining us, that's the summary. And we have our WhatsApp page, 08097. Hang on a second. 009444091. I almost gave out my number
You
again.
keep trying to give us your number.
I don't know. I'm sorry. So, doctor, there are a few myths that thank you very much, have dispelled, but there's still more.
Mhm.
And some of them even go into the ridiculous. You mentioned how sanitizers with alcohol can help.
Mm.
Some people have taken this a step further and are even wondering whether, okay, how about I just douse myself in it, or better yet, let me just drink it.
Inside myself.
Let me have it in my system if it's gonna help. Please, what's your thought on this?
Please do not drink alcohol or pour it all over your body or do that with chlorine either. When we're talking about alcohol-based hand sanitizers, that's just to basically clean your hands off with that. Just a little squirt and that's pretty much it. Some people are thinking that spraying alcohol or chlorine all over the body or swallowing it is going to kill potential viral particles. Guess what? That can be a danger to your intestinal organs and also damage your mucous membranes as well. So you should not be drinking that. You should not be pouring it all over your body. That's more dangerous than anything at all at this point. So that can cause serious and harm and damage.
Thank you very much. We have Emeka from Amuwo. Emeka, some of your questions have been answered, so I would leave those ones out. But he said something really important. He said we've been talking about deaths from the virus, but less about the successes achieved. What are the things that these countries, so other countries who have achieved success here or there, what have they done to achieve these successes, please?
So some things to achieve success is basically being able to identify suspected patients early on. So I think the fear that many people have, or most people have in the global health community, is that there could potentially be many patients out there that go undetected. And maybe it went over somebody's head in regards to the whole clinical picture and their symptoms and travel history, but an undetected infected patient is a huge fear, because guess what? If a patient has the virus and is undetected, then the potential to continually spread it through the community is high, and that's how the virus can propagate through the community. So what other places are doing well is identifying some of these patients early on, or identifying those who have had potential exposure.
Mm.
And that's what we need to aim to do in Nigeria as well.
So for those who have the virus, and I think that's what some people are concerned about, is it a death sentence?
It's a doomsday.
Yeah.
No, it's not a death sentence.
Okay.
But what we've seen are those that have died from the virus. Some of their clinical features, they've tended to be older.
Mm.
They've tended to have underlying chronic diseases, like maybe a respiratory disease of some kind already underlying, a long-term heart disease of some kind. Maybe they were immunocompromised, meaning they had a potential illness that, weakened their immune system already, like a potential cancer of something or something of that sort. So it's not necessarily a death sentence. Like I said, people have mild to moderate to severe disease. I'm sure you've seen in the news those people who have been tested positively, but they don't even have any symptoms at all. So it's not necessarily a death sentence, but if you have increased risk factors, it can be a more serious condition for you.
So, is there a cure? Can we say? Because if these people are still okay, but just don't have any symptoms, and there's another situation where they say some people from certain races are actually resilient to the virus. That's another myth. But first off, is there a cure? And then the race factor.
Okay. So there is no cure at this point. There is no treatment that has been known at this point to eliminate the virus from the body. There have been experimental treatments done in China, but nothing has been definitively proven scientifically to actually kill the virus and cure this. So hopes that we have are that a vaccine is created in the future to help provide immunity to it moving forward. But like I said, that's not happening anytime soon. So no cure at this point. But in regards to having some sort of genetic protection, that's also another myth that is out there. There's a myth that those of African descent are
Resilient.
somehow resilient to it, and they are not going to have any issues with corona. That is not true. There is no gene that is protecting Africans from potentially having the coronavirus. We have 2 cases in Africa already. Yes, we want to keep it minimal and absent in the country, obviously. But if we don't take the necessary precautions, there is potential for it to spread quickly throughout Africa. And it's not to, raise panic or anything, but we really just need to be very aware moving forward what we're doing to try to control things.
So Nee has a question on WhatsApp. He asks, I noticed a trend in China that face masks are used from time to time. Should we imbibe that here too? Is that effective?
So the recommendations about using face masks at this time, it really needs to be used for those who are actually sick with respiratory symptoms, meaning those that are symptomatic, coughing, sneezing, that can be potentially infectious. They should be used by those that are healthcare workers or taking care of people who are sick anyways. What are face masks going to do for you and I who are perfectly healthy right now? And if we were just wearing the masks right now, you're just wearing a face mask to wear a face mask at this point. Okay.
Is it time to call off certain cultures, like kisses on the cheek and stuff like that?
Yeah, shaking.
Yeah.
It's more so about being very vigilant. If you know that there's somebody that's sick or somebody that is coughing when you're about to be introduced to them, I think it's more than okay to avoid a handshake or a peck if you see that they're visibly coughing or sick. Just take general precaution.
All right, thank you very much. We're still having a conversation on coronavirus here on Lagos Talks 981. We have Dr. Nesochi, who has been really, really good with regards to breaking it down and making it as simple to understand as possible. When we come back from this break, it will be the final stretch, and we will be taking more questions from you so that we try as much as possible to, to give information so that you're not panicking.
Yes, exactly. I must say I feel much better now since after the past 45 minutes since you've been here, because I was, Lagos will be right back. I came in here this morning screaming, "We're all gonna die!"
Someone sent in an article, and I think we need to still talk about this. Saying
About-
chloroquine found effective against coronavirus. I'll just read it again for you to emphasize
Sure.
that it is not a cure.
Yeah.
So that
It's like a placebo.
it seems
Just
it's not
happy
too
that
much
was,
going on.
So,
Yeah.
yeah.
it's not charging. Oh,
not about how
okay.
many
It has
times
reached
you
its what's it
It's
called?
what you do with what you've got.
What do you call it?
Morning after morning.
Its battery is also dying, so now it's conserving battery by not giving anything else battery. Once.
Oh,
Start
really?
strong, finish strong.
I thought it was the
Stimulating
thing.
aroma and rich, creamy
just
taste
have to keep
of
it on.
Nescafe 3-in-1.
But this will last for whatever you want to use it for.
Some may say it's not possible to say possible throughout this commercial. So let's show them it's possible. You see,
Wait, okay, so
the
the people who have it who are still seemingly well, how long will they last for? And if they have it and there's no cure, that means they're gonna die, isn't it?
No, because it's not a death sentence.
So they'll just keep on having it?
No, just like a common cold, they'll be isolated, like the
Exactly.
Ebola was. That they put them. Some people survived Ebola.
Yes.
So they put them in one
Okay,
room.
so there is no cure, but there is possible survival.
Of course,
Yes,
of course.
yes.
Because if there were no survival,
Please,
everybody that's
if I'm
positive
thinking
with
this,
it
if I'm
would
thinking
die.
this, they're thinking that
Yeah,
too.
I was actually going. That's what I was
Yeah,
trying
yeah.
to ask with regards to it being a death sentence. That
Oh, okay.
Because when you have been diagnosed as having it, as being tested positive, it doesn't
Yeah.
mean you're going to die.
No,
So
not
like
at
a
all.
common cold, even though a common cold doesn't have a
Tide
cure.
through it,
Yeah,
yeah.
So your
That's why I
body fights it.
reiterated. To date now,
Yeah.
the mortality rate is
So
2%.
it's even lower than
Yeah,
Ebola.
exactly. Mortality rate is
2%.
at this point. The
Oh.
mortality rate is 2%.
So they're not dying, they just still have it.
Yeah, this is a new virus, so we don't know how it's going to take its course. But right now, the risk here is relatively low because there have been no
What are the
confirmed.
stats on children?
So children, it seems like they are not having it relatively
We
as
gotta
close
say
to
this. We have to say
adults.
this
'Cause
on air.
from all the reports that they've put out there, they're never really mentioning any
Children, yeah.
cases in children. It's more so middle-aged and older adults who have chronic medical conditions and underlying illness. So
That's it. That's brilliant. Please, Mazo is asking for himself first.
Because you don't know. I was panicking this morning after the health minister instance and then the
Oh,
US health
and I-
authorities
Number
saying
of
that.
people who are panicking.
And I read too many books about, little viruses here and
We
there.
haven't yet debunked
So I'm
belief
like-
about it starting in a lab. Yeah.
okay, we can talk about that.
That's
yeah.
what I believe. I believe
That's
that
what a
was
lot of
engineered.
conspiracy theorists
I believe it
believe.
was
It was
engineered.
engineered by the man.
Blame the book. I'm sorry.
Cerelac Junior with Iron Puff. It's a bowl of assurance.
All right, we're back in 30 seconds. How do we start?
Yeah, you can start
Okay.
and then go to your the one about death sentence.
All right, good.
The Smooth Drive at 7 p.m. gets you and the rest of Lagos discussing on daily human-related issues and the things we do. Oh my God, what things we do? The Drive Time discussions at 7 p.m. Come on. Every weekday on the Smooth Drive.
Studio. Well, Lagos, welcome back inside the final stretch here for Lagos Talks special here as we're talking with Dr. Nesochi Okeke Wokwe. We're dispelling myths about the coronavirus, and it's good to have you here, Doctor. I feel much more comfortable now. Now, if you are streaming live on YouTube, you would actually have heard some of the conversations that go on when the mics are off. We'll try and reiterate or try and talk about some of that, but join us on YouTube, on our social media as well. We are at Smooth 91 FM on Twitter, and you can send us messages on 0809444091. Now, Doctor, while the mics were down, I was asking you about the death rate. I was asking you about, from a question that I asked from before. Is it a death sentence once you have been pronounced to have the coronavirus? Because if you say there are no cures, then that means that perhaps, man, if you have it, you're going to die. But you said no. Do explain.
No, just because you've been confirmed to have the coronavirus, it does not mean that you are going to die. Right now, the mortality or death rate is at 2% since this has started. So what does that mean? There's a wide percentage and amount of people that are not dying for this.
98.
Exactly. Like I was stating before, the severity of symptoms ranges from person to person. So some people may have symptoms that are quite severe that may lead to complications
Mm.
leading to death.
And you also said, oh, sorry, go on.
And I was just going to note some of those complications that can
Yes,
occur
please, go ahead.
that may lead to death. Some of those things include pneumonia, that's the infection of the lungs. Another thing that can occur is something called acute respiratory distress syndrome, whereby the lungs just get really flooded with fluid, and that can lead to something called a septic shock, meaning a serious infection that could eventually lead to death. But not everyone is having that happen to them.
Mm.
So that's something that we really need to make clear. You can still be tested positive for corona and have minimal symptoms, or you can have moderate symptoms, or you can have the more severe
So
symptoms.
it's possible to survive it then.
Absolutely.
Mm.
Yeah,
But
no,
there is no
100%.
cure.
There is no, exactly.
All right.
Exactly.
You also mentioned that the death with the stats, the death rate has affected mostly older people, middle-aged people.
Yeah, it's mostly been affecting middle-aged and older people, or those with underlying medical conditions or chronic medical conditions that render one, immunocompromised, meaning that your immune system is already weak anyways from whatever that illness may be. So that's who it's been really impacting at a more severe level.
So is that why we're hearing little or no cases of children having it?
Likely. It's likely why. It's mainly those older ones with the underlying conditions. But we still have to be vigilant and aware because we don't know
Yes.
how this is going to develop moving forward.
So would you say even as a preventive measure to keep yourself healthy, so eat well, exercise, so have your immune system work, have a good immune system? Would that
Absolutely. That should be a general lifestyle choice that everyone should try to adhere to. The stronger your immune system is, the better it is for you to fight off many diseases. So just aim to be as healthy as possible, well-balanced diet, continue to exercise, do those things that will keep you strong and healthy. Avoid bad habits like smoking. Think about this. Smokers are damaging their lungs anyways.
That's the
They're
respiratory
exactly.
system itself.
Exactly. So if you're somebody that's a chronic smoker and then you're now faced with a respiratory illness, things are not going
Chances
to
are, yeah.
go in the best direction for you.
Very quickly, because this is important,
Sure.
as we're wrapping up, we have a conspiracy theory that it was engineered in a lab and to wipe a section of the population. How true is this? Because you mentioned earlier on that it's from an animal in Wuhan, China. But how true is it that it's actually it's man-made and was engineered in a lab?
So that is a myth that I keep on hearing as well, that somehow someone out there was able to engineer this disease and just put it out there to wipe out a part of the population. That is not the case. The way this came about was that the virus was transmitted from some unknown animal source at this point to a human, and thereafter it was that continued human to human transmission. And we get this information based off the history of other coronaviruses and how they've worked in the past. So when we look at SARS, a member of that coronavirus family, and MERS, that's pretty much how things occurred as well. These things were not just engineered to wipe off mankind.
All right, thank you very much.
Thank you very much,
It's been
Doctor.
such a great conversation.
It's so enlightening.
Yes, it has been. And if people wanted to follow you, because I do feel some people might have questions that they didn't have the opportunity to ask, or when you put out articles around diseases, conditions like this, and as might become popular later, could you please share with us your social media handles?
Sure. If you have questions for me, you can follow me on either Instagram, just at Nesochi, Nesochi, or I have more fun with Twitter, so you can follow me there at Dr. Nesochi, DrNesochi.
Because, Doctor, I was just going to say they might just get too distracted on Instagram soon. if you follow her, you know what I mean.
She's AKA Supermodel MD. Well, thank you so much.
Thank you
It's
so
been
much.
such
Thank
a
you
good
for having me.
conversation, and I do believe that you've allayed the fears of a number of people listening and giving us, Mazino, number one, and giving us some practical things to think about. We didn't talk about the testing though, with regards to how you can get tested, diagnosis, because do not go on Google, don't go on the search engine and find out what you're
Don't do that.
having.
go to a medical
But
facility.
you mentioned 3 centers in Nigeria. Where are they? Do you know where they are?
I know one of them will be in Lagos. I'm not
Okay.
quite sure of the other 2
I
locations.
probably one in Abuja as well, because in terms of
I'd hope
international
so,
travel, I
yeah.
think.
Well, thank you again, Doctor. We've been talking to Dr. Nesochi Okeke. It's been such a beautiful 3/4 of an hour, even more. And you have her handle now. You could follow her, perhaps maybe ask 1 or 2 questions. And I'm sure that we could always come back to you if we have questions. regarding
Absolutely,
this.
absolutely.
Well, thank you. Lagos, well, that's it then for it's a Wednesday, and what a Wednesday it's been. Thank you for being with us all the way since 6 a.m. up until now, from Beyond the Quotes till Lagos Talks. We still have great programming all the way inside of Smooth 98.1. It will be Coyote Baker joining us for Strictly Soul, and of course, at the end of the day, we'll be Charlotte Thompson on Smooth Sessions. Until we come again your way tomorrow, that's
Tomorrow,
for a
Thursday.
Thursday. It's goodbye. Have a great day.
Thank you so much. I'm glad I did.
Yeah,
Thanks for
that worked
reaching
out well.
out.
Do we have time for? I just want one picture
Oh
behind
yes,
there with
we
you
are.
guys.
We're gonna-